Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Coalition of civil society groups ask federal government to make ministries and agencies account for COVID-19 finances received. UAE state government says its vaccine acceptance rate has gone up several times by encouraging positive health-seeking behavior. And United Arab Emirates phases out COVID-19 restrictions as daily cases drop. Thank you for joining us. According to a new study from the Centers for Disease Control in the United States, infants whose mothers received 2 doses of an mRNA COVID-19 vaccine during pregnancy are less likely to be admitted to hospital for COVID-19 in the first 6 months of life. The study also suggests that vaccination later in pregnancy, after the first 20 weeks, appeared to provide better protection for infants than earlier vaccination. Meanwhile, in Nigeria, Nasarawa State continues to lead the number of eligible persons vaccinated with 1 dose, while the proportion of persons fully vaccinated is higher than all the states who have taken the first dose, except Jigawa. According to the National Primary Healthcare Development Agency, in the past 72 hours, Borno, Kano and Ogun leaped forward 1 step in the first dose performance, while Ebonyi, the FCT and Oyo experienced drawbacks. The agency also reports that all states in the southeast are still under the 10 low-performing states, including Bayelsa, Sokoto, Akwa Ibom, Borno and Edo State. Well, here's more on the pandemic update.
33 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 4 states and the FCT, indicating a drop from figures reported earlier. Lagos accounted for the highest number of cases with 13 infections. Kaduna had 9. 5 cases were logged in Delta and the FCT, while Rivers logged 1 case. The total confirmed cases in Nigeria now stands at 254,124. The report also includes a backlog of recoveries from the FCT, as well as 0 cases from Abia, Bauchi, Imo, Kano, Nasarawa, Niger, Plateau and Sokoto states. 15 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 230,472. There was no additional death recorded in the last 24 hours, leaving the fatality toll at 3,141. Currently, there are over 20,000 active cases in Nigeria, while more than 4.2 million samples have been tested so far. Over 16.7 million eligible Nigerians targeted for COVID-19 vaccinations have received their first dose, while more than 7.1 million of the population have been fully vaccinated. In Africa, over 11 million persons have tested positive, while over 244,000 deaths have been recorded across countries on the continent. The total global confirmed cases has surpassed 415 million, while deaths are now beyond 5.8 million.
And after expanding its COVID-19 vaccination centers from 55 to over 180, UAE State, the government says it would continue to adopt a persuasive approach to ensure that a significant number of the population is vaccinated. While giving an update to Channels Television, the Executive Secretary of the State Primary Healthcare Management Board explains that it has set a target after sensitizing the Emirate councils and religious leaders.
Anything that we can do to actually inculcate that habit, healthy habit in people is what will last. If you force people, we know what is happening on some other places. There are states that have adopted the so-called vaccine mandates, and they are among the states that are leading in vaccine racketeering, vaccine card racketeering. People will just go and racketeer and try to get fake vaccination cards and the rest, just to evade that. We felt that is not the best approach that we can adopt as a state. But as I have said, I am not prejudging the outcome of our meeting, but I know in UAE we think along the line of sustainable sustainable health, positive health-seeking behavior in UAE. We want people to be convinced that this is the right thing for them to do, and for them to actually take responsibility to do the right thing, so that all of us will take responsibility for our lives, for our health, and for our well-being and the well-being of those around us. Within a month, we have been able to jump almost 10 times what we have been able to vaccinate previously.
With the onset of new waves of COVID-19 infection in many countries since mid-2020 and the emergence of variants, governments have been confronted with sequencing policy action. National, subnational and local governments find they cannot count on following a straight or linear course on policy action to manage, exit and recover from the crisis. With all that the Nigerian federal and state governments have spent, is our healthcare better off? Also, the WHO says vaccinating the global population against COVID-19 is only long-term strategy to contain the coronavirus. So where are we indeed? Well, joining us to talk about this, we have in the studio Dr. Adefolari Opawoye, is the PRO, Nigeria Infectious Diseases Society, also a specialist in infectious diseases. Thank you for joining us on the program.
Thank you very much, Melissa. Nice to see you.
All right, same here. So what would you say Nigeria is in her vaccination journey? Early last year, the Minister of Health had announced the federal government's approval of 10 billion naira to support local production of COVID-19 vaccine.
Yeah, so I mean, the question is why do we want to produce our own vaccine? We already have vaccines that have been produced, they have been approved by the WHO. These are new drugs that they go through a long process of approval. You have to do several testings on them, and we have quite a few. I mean, we have lots of vaccines all over the world, about 16 vaccines, or 16 or 17 that has been approved by the WHO. Many developed countries really don't have their own vaccines. I mean, France doesn't have their own local vaccine. Belgium doesn't have, Spain doesn't have. So, I mean, you really have to question why we want to make our own.
But there is the vaccine inequity.
Yes.
And there is the race to reach herd immunity.
The question is the vaccine inequity going to be addressed by producing our own vaccines? Remember that in December, about 1 million doses were said to have had to be thrown away because is it really a question of vaccine supply or vaccine hesitancy? Or maybe these vaccines are not really being pushed out as they should be pushed out, And the question is, will those problems be solved by the local production of vaccines? I really don't think so. That's the truth.
So what do you think the solution is? I mean, you're saying that we shouldn't invest a lot of money in vaccinating.
No, definitely not.
Does that even have to do with the numbers we're recording in terms of the cases?
No. So you see, we have a lot of health challenges in this country. You understand? Not just COVID. Somehow we can't really explain why COVID hasn't hit us as bad as it has hit other countries. And so when you're looking at, allocating funds to these things, you're really asking yourself, what's the benefit of this? What's the impact that it's going to be? You understand? For example, we have thousands of people dying from snake bite every year, especially in the northern part of the country. We don't have any facility in this country that produces anti-snake venom. You have to go to these places, take the snakes from there, export them to the UK or Costa Rica, where the venom is extracted and then sent back to us as anti-venom. I believe that funds could be used to do that, you understand? So it's about funds allocation. There are so many vaccines out there that are proven to be working. It's good for us to have, to start having these processes in place, but I don't think, for me, I don't think I believe so much in a local vaccine production at this time.
So essentially no benefit as at this time?
I don't think there's much benefit. I think we could get much more benefit from those funds invested in other areas.
So we have certain facilities which are beneficiaries of the pandemic, and that includes the molecular laboratories across the country. There are also isolation centers.
Yeah.
So what do you think we can utilize them for? This is also fighting future epidemics, pandemics, infectious diseases.
I mean, one of the major concerns I've had with the whole COVID is that a lot of money came into the health sector 2020, 2021. You understand? We had a lot of money from the government. We had a lot of money from the private sector. So many organizations and affiliations donated huge sums of money. And for me and for most of us in the health sector, it's always been a concern that what are going to be the long-term gains from the COVID pandemic, Yeah, you talked about the labs, and the labs are a good one. Before COVID came in, we had only about 3 labs in the country that could diagnose this kind of infections. Now, we have, in Lagos alone, we have almost 30 labs or more, you understand, that can do these things. So, I think that's a gain, but I think many of these gains are actually, the isolation centers also could be used for various other things. I mean, even right now, many of them have been converted into health facilities for various other events. But, the challenge is that some of these gains have also been offset by the huge brain drain that we are having. I mean, one of the things I do, for example, is training people in isolation centers and all that as the team lead for Lagos State for the infection prevention and control. And I can tell you that more than maybe 40% of people we've trained in COVID management have left the country. You understand, for bigger shows. So it's not just about having the buildings, okay? It's not about having the equipment. You must have the personnel to run them. And most of our healthcare workers are living in droves every day. So that's also a big challenge. That's also
why haven't you left?
Well,
I trained a lot of people who have.
I keep asking myself that question every day. So maybe next time you call me, I'll tell you, oh, sorry, I'm in the UK now. I'll join your UK studio. But I'm still here.
But what do you think the problem is? Because that is a huge problem.
It's multifaceted, my own core group, my core friends, many of them have left, more than 90%. And they all left for various reasons. Some of them insecurity, some of them health. If you're sick, you want to be sick in a place where you have insurance to take care of you, where you don't have to pay out of pocket. Some of them left because they wanted, quote unquote, a better future for their children. Some of them also left because of money. I mean, you leave Nigeria today and you sort of like almost quadruple your net worth within a month or two at the same level of training and all that. So there are so many reasons for people leaving, but it's just, and people have always left, that's the truth. But it's just the numbers now are quite unprecedented in what we've done so far in the history of this country.
So what's your experience as an infectious disease expert in the fight of COVID, from when it started in 2020 up to where we are, out of the fourth wave, which we've heard from especially Lagos State government? What do you think the future is looking like?
Well, I mean, we're grateful for the Lord we have a number of cases now. I mean, we've been there from the very first case. I mean, February 27 is going to make a year that we diagnosed the first case in Nigeria, who actually went to Ogun State first, the Italian, and we've been there from the very start, from the very first patient up to now, managed thousands and thousands of cases. And this is not my first rodeo. I mean, I was there at the Ebola outbreak in 2014, the Lassa fever outbreaks and all that. So we've been in this thing for a while. With COVID, we're grateful for the Lord. We also very wary because we know that other outbreaks will come. We think that other variants may emerge. We're expecting maybe there may be another surge, another wave, probably around July, August. That was what happened last year. And then maybe another one by December. So we're not really, we're being cautious. We can't just fold our hands and believe that it's all over, And we're trying to use this time to gather strength, gather resources, and prepare for the next waves. We hope the other ways will be like Omicron. Omicron was quite transmissible, okay? A lot of people caught it. I don't know if you did, but people were not really sick. And so the health systems were not overwhelmed. But if we had another Delta was really bad because people were sick, health systems were overwhelmed, they ran out of oxygen, ran out of all sorts of supplies and all that. I think actually this should be a time to actually prepare for the next waves that are coming. Enjoying our rest for now. We hope it lasts.
We do really hope it does. But then a lot of people are saying Omicron, the next variant will perhaps be less, less virulent, than the Delta.
I mean when people ask me some questions, I tell them that if I can answer those questions, then I will be a prophet or a pastor. I don't know the answer to that. We hope. Because what Omicron did was that a lot of people were infected and so developed some form of immunity, but they were not sick enough. Many people didn't even need to come to the hospital, but we had some of the highest case counts we've ever had in the country since COVID came. So we hope that the next one will be more, but there's really no way you can predict this. Incidentally, we still had a case today in my facility, so people are still getting sick.
We appreciate your time. Thank you so much. Dr. Adefolarin Opawoye is the Infectious Diseases Specialist, PRO, Nigerian Infectious Diseases Society. Thank you for all the work that you do.
Thank you, Melissa. Thank you so much.
The Coalition of Civil Society in Abuja is asking the government to set up an independent panel to audit the way resources allocated for COVID-19 were utilized by the various ministries and agencies of government involved in managing the pandemic. Speaking at a joint news conference, the founder of Connected Development, Mr. Hamza Lawal, says the way monies and other resources meant for the pandemic were spent in shrouded in secrecy, as most inquiries regarding spendings by the group were not responded to. He also notes that the lack of transparency in spending breeds distrust, which is a major reason for the huge COVID-19 hesitancy experienced in the country. Vaccine hesitancy, that is.
Our government owes the Nigerian people an independent public audit of how COVID-19 resources was utilized. I think part of the problem why there is also distrust in Nigeria, and that has also contributed to vaccine hesitancy, is because there was lack of openness, transparency, and accountability of all the income and expenditure of COVID-19 resources. Our Freedom of Information letter between Connected Development and SERAP, a joint letter, was submitted to the Accountant General of the Federation. They responded and at that time told us that they had 35 billion and have disbursed 30 billion, but they had 5 billion in their account that they are yet to disburse. They refused to tell us who they disbursed this 30 billion to and who they would disburse the 5 billion naira to. We responded to them asking them for that information, and up till today, they have not provided, this information. When we were engaged in COVID, the last time we tracked their income was 38 billion, and they had committed to us that they were going to provide us with breakdown of income and expenditure. So breakdown of income, disbursement, and expenditure. And they committed that they would also get independent auditors to come and undertake an audit, that they will publish the report. As I speak to you, since that time they told us they had 38 billion. Up till now, they can't even tell us exactly how much they have and what they've done with this money.
Still ahead on the program, it's an ease in COVID-19 restrictions at public places and events in the United Arab Emirates. Join us for more. It's the gradual relaxation of COVID-19 related restrictions in terms of capacity at public places and events in the UAE. The National Emergency Crisis and Disasters Emergency Management Authority, during its weekly media briefing last Wednesday, had announced that all activities and events across economic, tourist facilities, shopping malls and transportation modes will operate at full capacity by mid-February. The Media Regulatory Office of the Ministry of Culture and Youth also announced that cinemas in the UAE will operate at maximum capacity from this week, and each emirate could modify cinema capacity easing or tightening procedures as they deem fit. Well, our Dubai correspondent Mayweather has more.
Economic and tourist facilities, shopping malls and transportation modes across the UAE now have the green light to return to full capacity as government begins phasing out social distancing protocols introduced to curb the spread of the Omicron variant. This update comes as a result of a decline in the number of daily infections, which dropped from over 3,000 in mid-January to less than 1,200 cases at the start of the week.
Man, I thought I did an Iranian accent and everything.
It would be the first time cinemas run at full capacity, more than 18 months after restrictions were first introduced due to the pandemic. Although mask wearing remains mandatory, social distancing in places of worship has been adjusted to 1 meter, while authorities in each emirate are expected to adapt the new protocol as necessary. Gulf Food, the largest gathering of professionals in the food and beverage tourism industry, is back with its largest in-person edition since 2020.
The lifting of the bans have actually increased the capacity of visitors, coming into UAE, especially Dubai. As you can see, in the Gulf Food Festival is filled to capacity because people have been yearning to network, to meet, and to negotiate business. So this has really helped in the tourism business, and it's actually also helped the food and beverage industry.
Industry practitioners operating in Dubai say the new development is welcome, even as they await a confirmation from the local authority.
It was a nightmare, I think, to see customers waiting in a queue, waiting to see that, there's an empty space. They have to maintain social distancing. Now, families which were coming with greater than 10 number of, packs or number of people, it was difficult to accommodate them together because we had to tell them to sit separately. So that was becoming a bit too much of a challenge, but I think now it's much, much better.
Meanwhile, other measures remain in place, particularly the Green Pass, which is required to access certain locations including the UAE capital, Abu Dhabi. From Dubai in the United Arab Emirates, Mayowa Adegoke for Channels Television News.
And Mayweather Adegoke, our correspondent in Dubai, joins us now. Hi, Mayweather. It's good to see you.
Likewise, it's good to see you, Millicent.
All right, the UAE has come a long way in fighting the pandemic so far. Is it now concluding that the strict precautionary measures are no longer needed?
Well, that's not what the government is saying. However, if you read, the writing on the wall, you can as well just take out strict from everything that they are doing. And if you're going back to full capacity, cinemas, events, parties, you name it, everything is now, green lighted to go full capacity. So that means that strict is out the door. So, like I said on the show with Amarachi, it's now up to each and every individual to take personal care and make sure that they are observing, safety measures as much as possible.
Talk to us about the numbers. We hear daily cases have dropped, but then what are the numbers saying? The country is still battling the Omicron-fueled wave, isn't it?
Well, as of today, we have 957 cases, and that's down from over 3,000 that we have recorded mid-January. So there is that decline, which is what is giving the government the confidence to go ahead with these new measures. In fact, the weekly media briefing that the government hosts will now be held every 2 weeks. So a lot is changing, and we see that speed to return to pre-COVID times.
To normal. Also, nearly 95% of the public have received at least 2 vaccine doses. While the government is encouraging booster shots for those fully vaccinated, how is that coming?
Well, it's going okay, but ultimately each individual is having to decide if they're going ahead for the booster shot or not. You have people who have gone for the booster shot, and you have people who aren't, going for the booster shot just yet. Also keep in mind that you're only allowed to take a booster shot 6 months after your second dose. So you also have to keep that in mind.
So have you heard from people with regards to the reactions to, the latest ease of restrictions?
It's definitely a welcome development all around for businesses. They're able to go back to business as usual. They're able to, get all their clients in. If you want to have a full hall or full restaurant, by all means, go ahead. So that's great for business. On a personal level, it also means that, and then again, as I've been saying for a while, it's almost felt as if COVID isn't here because of just how open it is compared to other countries in the world. But now with that green light from the government saying, by all means, go ahead, it means, for instance, that the penalty that the government had stated before, if you weren't observing the rules, up to 3,000 dirham fine, obviously that means that that's out the window. So there's a lot more liberty. However, people are still cautious. You have people who are free to attend events. If it's packed, they're okay with that. And you have other people who are quite cautious. You see a packed hall, you're quite cautious to say, you know what, maybe I need to step back from this. So it's definitely a welcome development all around, but people will now decide what they want to do personally.
Mayweather Adegoke, our Dubai correspondent. Thanks, Mayweather.
Thanks for having me.
And after taking into account the high vaccination rates and concluding that strict travel rules no longer have a significant role when it comes to stopping the virus from spreading, several European Union countries have decided to lift their pre-entry testing requirement. While several countries lifted some of the restrictions earlier this month, others like Finland, France, Portugal decided to evaluate the situation once again and then make a decision. Here's more now Global Update.
Singapore is expanding its quarantine-free travel to Hong Kong, Qatar, Saudi Arabia and the United Arab Emirates this month, resuming border reopening after a pause due to an outbreak of the coronavirus. The city-state will also restore and increase quotas under its vaccinated travel program, which had been reduced in December to deal with the Omicron variant.
As we learn to live with COVID-19 and Omicron, it is essential that we progressively open our air and sea borders. These steps will restore and expand our VTLs and put our border reopening back on track. They will enable us to carefully restore our connectivity, especially our regional neighbors. The connectivity with them is specifically important for our hub, and we want to do all of this while safeguarding public health. Our ultimate goal is quarantine-free travel for all vaccinated travelers.
7 designated clinics have been opened in Hong Kong's Special Administrative Region on Wednesday to treat patients with mild symptoms, as the region has seen increasing infections recently. In the meantime, dozens of COVID-19 patients in Hong Kong are being treated in makeshift open-air spaces outside medical centres in the chilly weather, with several hospitals operating at over 100% capacity. It comes as health authorities in the global financial hub reported a record 4,285 confirmed new infections, more than 40 times the level at the start of February. Hong Kong also reported another 7,000 preliminary positive cases. Authorities added that 9 people have died from the virus in the past 24 hours, including a 3-year-old girl. Hundreds of protesters continue to occupy lawns in front of New Zealand's Parliament House for a 9th day on Wednesday, ignoring repeated calls by police to leave. Claiming inspiration from similar anti-vaccine mandate demonstrations by truckers in Canada, the protests have also blocked several streets in Wellington with their trucks, vans and motorcycles. Police say some progress have been made, however, in engaging with protest leaders, and about a dozen vehicles have left after an ultimatum was issued on Tuesday to move out or risk having vehicles towed and seized.
You can visit our websites for more updates and a better understanding of the pandemic, plus breaking news at your fingertips. It's channelstv.com. That's our program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.